Common sleep disorders. Over 40 million Americans are thought to be dealing with some type of chronic sleep disorder. In addition to those numbers, there are millions who have to deal with occasional insomnia or disrupted sleep patterns. To date, there are over 70 different types of sleep disorders, with the most common being insomnia, sleep apnea, restless leg syndrome, narcolepsy. Insomnia is the one that most people are familiar with. It is defined as experiencing a poor quality of sleep, and it includes not being able to fall asleep or stay asleep. Insomnia is extremely common and occurs in almost 50% of the U.S. population. About 10% of people are dealing with chronic insomnia. This is insomnia which has been going on for years. Sleep apnea is a disorder that affects your breathing. People with sleep apnea will have a reduction in their breathing patterns, and they may pause breathing altogether. There are two different types of sleep apnea. Central sleep apnea is where the brain does not send signals to the muscles to breathe. Obstructive sleep apnea is where the brain does send a signal to the muscles to breathe. What happens is that the person's airway is obstructed and prevents the correct amount of airflow to pass. It is possible to suffer with both forms of sleep apnea. Many people with this condition are obese and have to sleep with breathing apparatus during the night. Restless leg syndrome is a sleep disorder that makes a person feel uncomfortable sensations in their legs. The person may also have an uncontrollable desire to move their legs. This is not a condition where your legs cramp, rather that you experience strange feelings such as tingling, pins and needles, pulling, or a prickly feeling. It is thought that the reason this causes sleep issues is because it is so difficult to find a comfortable position for your legs. Narcolepsy is a disease that affects your central nervous system. This results in you experiencing daytime sleepiness, known as EDS. People who have narcolepsy often have loss of muscle tone, hallucinations, and an inability to move or talk. These symptoms can be present altogether or individually, and they can be in various forms of severity. If you think you may be suffering from any of these sleep disorders, then consult with your doctor for further advice.